Well, good morning and welcome to Body Talk. I'm John Ashton, and we are joined in the studio by Dr. Susan Berberich, MD from Kentucky Eye Care. Doctor,
good morning.
Good morning. Glad to meet you. How are you?
I'm great. How are you?
Fine. Okay, I'm wearing glasses. You're not. Suddenly, I feel inferior. But and some people say it's okay because you are inferior. But
I've had LASIK.
Have you?
So I
did you do it yourself?
No. That can't happen. But one of my partners did.
All right. Basically, the eyes are. You hit 40 and you start developing some focus problems.
Symptoms. Yeah. The kind of chronologic order of how the eyes progress is most people don't need many glasses to speak of until maybe 10 years old. And that's when most people, if you're going to get nearsighted, you start getting nearsighted.
Okay.
And so all those people that are nearsighted have glasses all their lives. Those of you're probably one of them that was lucky enough not to need it until you're 40, presbyopia kicks in, and that's where you can't accommodate is the word we use, but zoom in. You can't zoom in. You can see far, but you can't see close up.
Right. And to read, I need like 300-watt light bulbs.
Right.
Yeah.
Light helps, squinting helps, but easier on your eye than either of those is to just get a pair of glasses to help you.
That's it. $19.99 at Walgreens, there you are, and you can read. But does it continue to degenerate as time goes on? Or
yes, the presbyopia continues. You need, when you first get those glasses, you might need a smaller power. Then over the years, you need more and more, up to a maximum. There is a deadline or an end point where you don't need any higher powers. And at that point, the glasses are doing all the accommodating, and you're doing none.
They're doing all the work for you.
Right.
Oh, I like it when other people do all the work for me. That's pretty cool. All right, so now you guys specialize at Kentucky Eye Care, or maybe specialize is not the proper term, but cataract surgery and LASIK surgery and really serious operations.
Right. We are a general ophthalmology group. We have a subspecialist in retina and a subspecialist in plastics, oculoplastics. But in general, what we do is general eye exams and taking care of medical diseases of the eye, everywhere from glaucoma, cataracts, macular degeneration. The majority of our practice is probably cataracts and glaucoma, and that's because of the demographics. That's just what happens to most people as, a couple of birthdays happen.
Yeah.
So,
those pesky birthdays keep popping up, don't they? One quick question on macular degeneration. Is it reversible at all?
I wouldn't say reversible. If you catch it, you can stop it, but you can't reverse it and make it go away.
Okay.
And there's been some wonderful, almost, I hate to use the word miracle, but it's like a miracle, the treatments, changes that have happened in the last, say, 4 or 5 years in macular degeneration. For the maybe you know this, maybe you don't. There's 2 types, wet and dry. The wet kind is the kind that happens very suddenly, and the kind that used to make people pretty much blind, central vision anyway, blind. That's the one that we have the best treatment for now.
Really?
It is. I get goosebumps thinking of how much it helps people now.
Right. I'll have to send my dad in to see you because if he was looking at you right now, he couldn't see you.
Yeah.
He has to look peripherally to see anybody.
See, he may have had his macular degeneration come, to its maximum before we had these treatments.
Yeah. Yeah. That's a situation sometimes where medical science doesn't quite make it for everybody.
Exactly.
But let's get back to the cataract surgery now. They're making advancements in that even as we speak.
Yes. The advancements in cataract surgery have been tremendous over the past decades. You probably remember, I hear people telling me stories of their grandparents that had to have sandbags and they had to lay in bed for 6 weeks to heal, and all that it is so much different. Nowadays, if you have cataract surgery today, you can be driving in 2 days. You can do most activities in 2 days, maybe not the heavy lifting or real strenuous things, but it's an amazing difference. So those advancements have been going on for decades. What's the newest things now are we have multiple choices in lenses that we can insert when we do cataract surgery. And the very newest is there is a new laser. It's actually the same laser that you use to do LASIK, but they are finding new uses for it in cataract surgery. It's so new that there's not even anybody in this region that has one of those lasers yet.
Really? How much, to get an MD, first off, you go to school forever.
Forever.
You're graduating, and most of your high school compatriots are entering their second
career or something. Yes,
or
exactly.
Their second decade at whatever career they've chosen. But if you don't continue learning and getting training, then all this stuff passes you by.
Oh, absolutely. You have to continuously.
When do you have time to work?
I guess the word vacation takes on a whole new meaning. When you have a vacation, you're really in training. It doesn't mean you're relaxing. You're going to a meeting. You're taking a course, things like that. So you're absolutely right. It keeps changing, and I thank God for all the inventors, the engineers, whoever makes all this technology that we get to use. I mean, I thank them every day, but we have to keep up with them. We have to.
It's got to be.
We have to go to school constantly to keep up with them.
Because, even not just from a medical standpoint, but from a business standpoint, you can't let the guys down the street do something better than what you're doing, or that's where everybody starts going. So
there's some truth to that.
Yeah. What is a cataract exactly?
The cataract is the lens of your eye. Mm-hmm. When you're young and it's not opacified in any way, we call it a lens. As years goes by, it is made of protein, so it changes like other parts of your body change. And as it ages, it gets discolored. It can be yellow, brown, can have some white lines or creases or spots in there.
Right.
And so it's the same part of the body, you just change the name, and now it's called a cataract.
Gotcha. And so that's physically removed and replaced?
Yes. There's no way to yet, though people are working on it. There's no way to reverse that aging change and take those opacities away. So the only way we can get rid of it and make the vision better is to remove it and replace it with a plastic or acrylic implant.
Wow. The thought of a laser and people, I mean, I can't even put eye drops in my eyes effectively. I'm very, very nervous about anything getting close to my eyes. The thought of having a laser and things like that scare me to death, basically. But are you conscious for that procedure? Or?
Yes. Most people are. Some people fall asleep. They give you the same kind of medicine that you have when you're having, say, a colonoscopy. Most people have had that if they're over 50. And it's very relaxing. You are kind of awake, kind of asleep. If we were to wake you up and say, John, move your eye, you could do it. Okay. But in general, you're so relaxed you don't really care.
Is that the medication that my wife, who's the nurse, refers to as milk of amnesia?
Some people use that one. That one is a little stronger than the one we use.
Okay.
You're not quite that far under.
I want to be all the way. Okay, just I don't want to know. Just do it and let me out of there.
I kind of agree with you, and a lot of people say that exact thing.
Right. What types of problems with eyesight does LASIK correct? I mean, who is a candidate for LASIK surgery?
A candidate for LASIK surgery, not anybody, but most people that have any kind of refractive problem, nearsightedness, farsightedness, astigmatism, the things that limit you that we don't have yet is like a bifocal LASIK. We can't make you see distance and near.
Okay.
In the same eye. You can have one eye for distance and one eye for near, but we can't do it all in the same eye.
Does that mess up depth perception badly if you do it that way, or?
It does interfere with depth perception to a degree for your real fine depth perception, like threading a needle maybe, but for walking around, it really doesn't.
Unnoticeable.
Yeah.
That's great. So, but when you read the ads and they say, come in for a consultation to see if you are a candidate, I guess maybe it's easier. What things would preclude you from being a candidate for LASIK surgery?
Certain things. If you had bad macular degeneration, you wouldn't be. You could technically still do it, but it wouldn't help you. So you should not perform LASIK on that kind of person. Some medical problems. If you have severe autoimmune diseases or healing kind of diseases, things like that would preclude you from being a good candidate.
Okay. And eye surgery, I mean, it's medical procedure. There's usually not a problem with insurance covering parts of it, or?
Insurance will usually cover cataract surgery, it does not usually cover LASIK surgery.
Basically considered
They consider, the insurance companies consider that a cosmetic procedure that can be corrected by glasses, so why should they pay for it?
Yeah, we'll pay the $100 for your glasses. So
That's their thoughts, yes.
But and is LASIK, is it a forever procedure, or
does it regress? Is that what you're asking me?
Yeah.
In some people, there are some changes. In the majority of people, it's a forever.
Okay. So basically, if someone's tired of wearing glasses or they're having problems, the good thing is to go to an eye doctor.
Yes,
immediately.
To go to an ophthalmologist and find out why you can't see. It could be a medical problem. It could be something very serious. Or it may just be you need glasses or a change in your glasses. And it is so vast, the possibilities that it could be. So it is important to see your ophthalmologist.
And the differences between an optometrist and an ophthalmologist are more than just pronunciation. One needs to make sure you're heading to the right source for the right answer to the right problems.
I totally agree with that. The training is vastly different.
Yeah. So where is Kentucky Eye Care, specifically your practice?
It's in 6400 Dutchman's Parkway.
Okay.
The Springs Medical Building is the name of the building.
Right in the shadow of all the hospitals out there.
The hospitals, yes.
So you're
in the shadow of Caden Tower.
All right. So can people just call for an appointment to come in and
Oh, absolutely. Call. We have 9 doctors, and like I stated earlier, we have 2 specialists, subspecialists, and we do everything from general eye exams to the most sophisticated cataract surgeries and laser surgeries.
All right. So highly recommend, the world is a wonderful place to look at, and we want to keep looking at it.
And we want to see it as sharp as we can.
Don't we, though? So give Dr. Berberich and the rest of her crew over there at Kentucky Eye Care a call. Come in anytime. And the phone number again was 896-8700?
Correct.
Good. See, with the glasses, I can read that small print.
He can read it. I'm very proud of you.
All right, Doctor, it's a pleasure meeting you, and thanks for joining us this morning here on Body Talk.
Yes, thank you for having me.